Assisting to ambulate using a transfer belt. This skill is used to safely transfer patients and provide support while they ambulate. It's used for the patient who requires assistance standing and walking due to illness or injury. If not performed often, it can cause illness related to immobility such as depression, constipation, and pressure sores. If performed incorrectly, it can cause the patient to fall. An improperly fitting gait belt can cause skin tears and bruising. You will have 3.5 to 4 minutes to complete this skill, and you will need one gait belt.
Hello, Miss Kanisha. I'm Nicole. I'm going to be your caregiver. Let me just check your wristband. So I'm going to get you up and take you for a little walk, stretch your legs a little bit. Is that okay?
Yeah.
Okay. So you want to make sure the bed is in the lowest position. Make sure your patient's feet touch the floor. And they sit up. Okay, I'm going to raise the head of your bed up so to protect my back. So I'm just going to take you up a little bit here. Okay. Want to lock the bed. Anytime you move your patient in or out of the bed, you want to go ahead and lock it. So different beds lock differently, so you want to learn the bed that you're using. We also wear a gait belt. We're going to put this around our patient to make sure that we keep her safe when we walk. So there's no privacy on this skill either, so I'm going to go ahead and wash my hands, and I'll be right back. So I'm going to go out, simulate wash your hands. I'm going to come back in, go ahead and pull the covers down. So I'm going to assist you to sitting up in a sitting up position, get you on the side of the bed, and then we can get your shoes on, okay? I'm going to take my watch off so I don't scratch the patient. So you want to make sure you get a good stance, and then you want to pivot. You don't want to use your back muscles, you want to use your lower body muscles. I'm going to have you sit up forward for me. So one hand goes on the shoulder blade, so we go on the back across here, not the neck. And the other hand goes up under the knees. And you pull, get your patient in close to you. Put your hands across your lap, please. So on the count of 3, I'm going to sit you around. So 1, 2, 3, and then we turn. Okay, you want to make sure your patient's feet are touching the floor. If they're not, can you sit forward for me? Okay, go ahead and put your shoes on for me, please. And you can either have your patient put their own shoes on, or you can assist them. Looks like we're sitting on the remote here. That's okay. Okay. And always stay close to your patient to make sure they're safe. Okay, so I'm going to go ahead and put the gait belt around your waist so we can go ahead and walk. And we're going to walk 10 feet. We're going to simulate that. We're going to walk a few steps here and we're going to come back. And put the gait belt around your waist. Make sure it's flat around the waist. Don't put it too high or too low. Make sure it's snug. You want to put the gait belt, the strap through the part with the teeth, the prongs. You put it through there first. And you get as tight as you need it. You can always tighten it up a little bit more later. And then you just kind of loop it through and put it through the other side. And if it's still too loose, because you want to have it nice and snug, just take this little loop here and pull it back a little bit until it's as tight as you need it, where you get a couple of fingers through. And you want to tuck this belt in, however you want to tuck it, just so it's out of your way. Okay, so you want to make sure that you're touching your patient somehow to secure them, so your foot can touch their foot, your knee can touch their knee. You can go down in front of them. I prefer to have my foot touch their foot and my knee, and then I kind of bend and I rock back and forth. So we have two options here. You can either put your hand on my waist as we stand up, or you can put your hand on the bed and push up. So which one would you like to do? Okay, so I'm going to come down and bend down, grab the belt securely. And then on the count of 3, we're going to rock. So on the count of 3, we're going to stand. 1, 2, and 3. So we stand up. I ask your patient, are you dizzy?
No.
Okay, so slide your hand around one in the small of the back. I'm going to turn you around. So one in the small of the back right there. In the other hand, just kind of at an angle, because you want to be at an angle, just in case your patient goes down, you can take them down safely. So we're going to walk 10 feet according to the book. We're going to take a few steps here. Okay, very good. And we're going to just turn around and go back to the bed. Make sure you hold your patient securely. Okay, I'm going to gently turn her around. So let's go ahead and take a few steps to your right. Okay, Go ahead and back up. Let me know when the back of your legs touch the bed.
They're touching.
Okay. Keep the belt secure. So again, you can either put your hand around my waist or you can reach back to support yourself as you sit down. Okay. Get your foot close to your patients again. So on the count of 3, we're going to sit. 1, 2, 3, and we squat down. Make sure you never bend with your back. You always want to squat. Use the big muscles. Nice smooth transition. Go ahead and take the belt off. Then you can go ahead and take your shoes off for me. Once again, stay close to your patient. Make sure they stay safe. Okay, I'm going to go ahead and help you get back in the bed here. Same way, across the shoulder blade, under the knee. So on the count of 3, we're going to just pivot back into the bed. 1, 2, 3. Nice smooth transition. Okay, go ahead and lean back with me. I'm going to cover your back up. Okay. Now I'm going to go ahead and... So the bed is already in the lowest position. Would you like the head of your bed to stay up, or would you like it down a little bit?
Stay up.
Okay, so leave the bed up. I'm going to give you a call light in case you need to reach me later. So is there anything I can do for you before I go?
No.
Okay, great. So I'm going to wash my hands, document the skill, and skill is complete.